you love your pet. And I mean, there are very few pet owners I've ever known who say, gosh, my pet has lived long enough. Every one of us wants 10 or 15 or 20 or 25% more time with our pets. And the good news is that a combination of veterinary care and longevity science is allowing us that ability to extend our
Again,
pets' lives by that much.
you're listening to the Soul Touched by Dogs podcast, the show for dog lovers who see dogs not as toys or tools, but wise souls worth our respect and care. I'm Anke and I'm your host. Hello and welcome, Dr. Kevin. I'm super excited to have you here.
Well, thank you very much, Anka. I've been following your podcast for some time and just appreciate everything that you're doing for both dogs and their pet parents.
Oh, thank you so much. And I'm really looking forward to this conversation in particular, but I'm going to let you share about that. But before we go there, as always, where in this lovely world are you based and what's your business with dogs?
Okay. Well, I'm based on the coast of California, and my business these days, I've been a veterinarian for 40 years, Anka, but over the last 7 or 8, my business has evolved strictly into the care of older pets. I deal specifically with pet longevity for both dogs and cats. And so, as such, that it's not just longevity writ large, but in particular, there are three different problems that affect many older pets. One is cancer, one is heart disease, and the third is chronic pain. And so, those are areas that I spend much of my day helping pet parents throughout the United States and Canada and the UK, for that matter, with.
Oh, wow. And I'm just like, well, I've lost two dogs over the years and they both made it to a decent age. So I'm quite proud of that. But it's obviously a topic that, we're all interested in because, who wouldn't want their dog or cat to live as long as possible? So now I'm curious. Um, the fact that we're looking at longevity and things we can do, what, in your experience, are we just more attached to our pets these days that we just want them to be around longer, or are they not living as long as they used to, or what's the situation?
Well, I think that honestly, the combination of better food, better veterinary care, and quite candidly, better parenting has led to an extension of our pets' lives across the board. Now, there's no accounting for the bad luck that accompanies cancer, cancer diagnosis, et cetera. But I think if you and I looked at the length of a pet's life now compared with 20 or 30 years ago, we'd find that they've actually improved or increased during that time. But one thing that has held true since I was a child, and that is you love your pet. And I mean, there are very few pet owners I've ever known who say, "Gosh, my pet has lived long enough." Every one of us, every one of us wants 10 or 15 or 20 or 25% more time with our pets. And the good news is that a combination of veterinary care and longevity science is allowing us that ability to extend our
Yeah.
pets' lives by that much.
Yeah, I'm obviously got to dig into that. No, but
Yeah, okay.
before we go there, I'd be curious. Like, what's the story behind that for you? Because most of the time, like, if you've heard the podcast before, most of the time there's a bit of a pattern. People always say your mess is your message, right? So there's what's your personal story behind that? Because I've had people literally just published an episode where somebody was specializing in resource guarding. Well, guess what? Her
Hmm.
dog had the problem, right? I've had
Yeah.
people where the dog chased after, like real, like chasing anything that moved. Well, guess what their dog struggled with, right? So it's like, is there a story like that in your background, or what drove you to specialize into that particular area?
Well, there are probably two stories, actually. One is the fact that in veterinary medicine, Anka, things happen in cycles. You may not see a particular type of case for 2 months or 3 months, and then on one day you see three of that particular type of case. And about 10 years ago, I ran into a group of older pets who were orphaned. In other words, these were older dogs or older cats whose single pet parents had died. And so, these were 13 or 14 or 16-year-old dogs and cats who were being uprooted from their family home and tossed back into a shelter setting. And many of them had health issues of their own. But I thought, how heartbreaking is it for an older pet, or for that matter, an older individual, whether you walk on two legs or four, to
Doesn't really
be
matter.
ripped out of your home and run through what is essentially an orphanage, a shelter setting. And so since that time, I mean, that really resonated with me, to be honest with you. And so since that time, I've established a couple of local shelters specifically tailored to the needs of older pets. I work with a number of pet shelters throughout California, uh, throughout Southern California in particular, that deal just with those older pets and how best to help them as they go through this transition. So that's one story that I would offer. And then the second story is much more personal for me because when I was 44, 45, I went in for routine blood tests and they came back slightly out of range. And to make a long story short, I was told that I likely had a fatal form of cancer called myeloma.
Oh,
And, I, at that point, 44 or 45, I was in the gym most days. And so, it was quite an abrupt change to the way I looked at my life. And so I ended up self-referring down to the Mayo Clinic here in the United States and had a bunch of diagnostics done. And to make a long story short, found out that diagnosis of myeloma was incorrect, but that I did have a precursor condition. And so, just as you would do, I started researching, well, how the heck can I prevent this precursor from becoming the real deal? And there was not one drug, there was not one pharmaceutical drug that helped prevent that transformation from occurring. But there was a natural herb called curcumin that
yeah.
that did
Mhm.
help to prevent that progression from occurring. And so that really opened my eyes as an allopathic or traditional veterinarian who was trained with injections and surgeries and vaccines, et cetera, to the benefits of integrative therapy or the use of herbal therapy and now longevity drugs in particular, but also acupuncture and laser therapy and all the
Mhm.
different ways that you and I can combine therapies to offer our pets the very best outcome.
Oh, I love that. I love that. Because there's more than one way, right? And what works for one doesn't work for another. And I actually remember my first dog, Leo, he had, I don't know, when he was 10, he didn't like all of a sudden like he couldn't walk anymore, right? And loads
Mhm.
of tests and no idea. Like and so
Yeah.
I made him golden milk, and
Okay.
he gobbled it up and he recovered. He lived another 6.5 years,
Mm.
and
Good for
um,
you.
and it was really interesting because when he was well again, he looked at the golden milk and went, yeah, you can have that. It was really interesting. It's almost like as if he knew when he needed it, his body kind of knew,
Uh-huh.
so he
Uh-huh.
literally, yeah. So yeah, I'm not surprised that curcuma is in there. That's fascinating. So now you mentioned before, like very specific numbers about the improvement in longevity. Like, how do you achieve them, and how do you even measure that?
Well, so I'm going to answer that in a couple of different ways. As you just spoke of, the best results for our pets, whether we're talking about a specific health issue or in fact trying to extend their lives, are achieved by using a number of different things, Anka. The reality is if you and I just use a drug or just use a surgery or just use an herb to help our pet, we may see mild benefit, but the best results are achieved when we use all of the above.
Mm.
And so there are two drugs that we commonly use as longevity benefits in dogs and well, in dogs in particular, but also to a lesser extent in cats. One is rapamycin, and the second is acarbose. And these are drugs that have been proven to extend life in all mammal species by up to 14% in the case of rapamycin. And the second drug, acarbose, adds another 5 to 7%, but just for males, interestingly. How about that? Not so much for females. And so there's a long mechanism behind that. But at the end of the day, these are documented. This is not just smoke and mirrors. The reality is
Mm.
I've been a veterinarian for 40 years. And so there's a lot of marketing, there's a lot of BS out there, Anka. And what matters most to me are the things that I have learned either through 40 years in veterinary clinics helping pets like yours, or the medical studies that are available on PubMed, Google Scholar, etc. And by applying them, you and I can offer our pets the very best in health. Now, I mentioned longevity drugs right off the bat because as a veterinarian, that's what I do believe in them. But let's be clear, there are a number of other things that can benefit pets as well when it comes to their lifestyle. One is just simply their diet, their lifestyle at home. And we can talk more about that in just one second. The other part of things, though, is that dental care. We never knew how important dental care was to not only the quality of life, but also the quantity of life for small dogs and cats. Happy to talk more about that. And then we
Mm.
got the supplements that you and I could discuss at length. We could probably spend an hour or two just talking about supplements that are proven to help health and supplements, unfortunately, that have no health benefit behind them, but are widely used by both humans and pet parent, or by in both humans and veterinary medicine as well. And so, in my mind, though, all of this starts with developing a relationship. Not all veterinarians are comfortable in talking about longevity strategy. Not all veterinarians have the time or the training to do that. And so it's just like you and I have to find a human doctor, a medical doctor who has the time to sit down and actually talk with you and give you a hug when you need it, or slap motivation. So do pet parents, and that's kind of where I come in.
Yeah, I love that because it's sometimes, especially like in my experience in Spain here, I have often had the experience that there isn't much knowledge beyond sort of what was taught in vet school. So, like you'd always get
Right,
me
exactly.
with, when you started to share that you started to look at other ways, and I'm like, well, I'd always trust somebody like
Yeah,
that more who has a bigger picture and has more tools available rather than the only thing I have is a
right.
hammer, so I'm gonna whack a nail. I'm gonna whack on
So
every nail
everything
with
is
it,
a
right?
nail. Yeah,
Everything is a nail. So that's
right.
kind of
And
like a
that's
very common scenario that I've experienced with vets here, which kind of doesn't help anyone really.
And that's very true. I mean, the reality is that we veterinarians, we're very good at solving an existing problem. If you come
Mm.
in and your dog has a cut foot, or
Yeah.
if your cat has an abscess or whatever, day in and day out, the veterinary world is very good at solving those existing problems. But what many veterinarians are not so good at, Anka, especially here in the United States, are being able to sit down on the floor with you and look
Mm.
not just a couple of days into the future, not just over the duration of a healing cut, but what's going to happen 2 months from now, or 2 years from now, or 5 years
Mm.
from now, and develop a plan to help moderate those risks.
That's such a true point. Yeah, like it's problem solving usually, and not avoiding problems. Yeah,
Correct. Yeah. Yeah. We want to take a proactive stance, not a
yeah,
reactive stance to our pet's health.
for sure. And you already hinted at nutrition. It's funny because I found that my dogs they've never, like the youngest one, she doesn't even like the youngest two, they don't even know what kibble is. Like I don't know, they'd probably eat it. I don't know, sort of like you'd eat like a
Uh-huh.
treat or something, but that's not. And I noticed that their teeth are like perfect. Like it's almost like they don't get that build up from.
Yeah.
I mean, so are they
Absolutely.
are they are the two connected? I mean, that's sort of just an
Yes, they are.
observation
I mean, the
that
the
that I've
reality
made.
is that,
Mm.
yeah, and I think you're exactly right, Anka. And to be clear, I'm 66 at this point, and so until I was, I'm going to say 45 or so, I fed my dogs kibbles, thinking I was offering them the very best in nutritional care, because that's what we were marketed to, and
Yeah.
that was kind of the demographic that believed in that. But now there's increasing proof, Anka, that the use of the standard kibble that contains a lot of sugar so that they can be glommed together into pellet form, that contains the artificial flavorings and preservatives, and then is baked at a very high temperature. All of these things are bad for our pets. Not only do they reduce nutritional quality, but also many times the byproducts of the cooking process actually can set the table for our pets to develop cancer longer term. And so, as you have found out, I'm a great believer in the benefits of home cooked or at least a higher quality of diet. But if you and I can get away from the use of the old-fashioned dried kibble in 20 or 30 or 40-pound bags, our pets will live longer.
Yeah, it makes so much sense. And it can still be quite hard to convince people, right? Because it's so predominant. And I remember when I got my
Yeah.
first dog, well, that's what the vet told me to feed. Don't you ever
Yeah.
feed him anything else, right? Only feed the
Yeah.
kibble. And
Right.
obviously, you trust it, and until you realize, well, actually, I was lucky because Leo didn't do well on it. He was a street dog. I
Mm-hmm.
mean, he was a street dog when I found him. I mean, he was a
Mm.
street dog, like he's a puppy, he's 4 months old. But
Yeah.
but he basically he hadn't grown up on it, right? So when
Mm-hmm.
he first got it, he goes, well, what the heck is that, right? And then he had skin issues,
Yeah.
and so he didn't
Mm-hmm.
do well on it, which was lucky in hindsight because it made me look
Yeah.
at the labels like really from the beginning, right? So, but that's definitely.
Absolutely. And I can't count the number of pets that I have seen, both dogs and cats, who are on a standard kibble diet and they come in and they're itchy dogs or cats with diarrhea. They have really poor hair coats. And if you make this sudden change to just a simple dietary change from a kibble to a better quality diet, many times those health problems will disappear of their own accord without further treatment. So you're exactly right in the things that you have spoken about.
Yeah, so that's a great first step. Now, I'm curious about the dental care. What would you recommend? Because again, like I remember little Leo, my mom would buy him these dental sticks that they sell
Uh-huh.
here, and he'd go run
Hmm.
off with diarrhea until
Yeah.
like, wouldn't like them, wouldn't, so
Uh-huh.
what would you
Yeah.
recommend somebody should do to keep the mouth healthy?
Well, so I'm gonna take one step back and then I'll address your question. And that is that we think at this point that the single greatest driver of human aging or pet aging is just simply inflammation within
Mhm.
our system. And for dogs under 25 pounds and for cats, the single most common source of that inflammation is dental disease.
Wow.
Now, for larger pets, we can also talk about orthopedic problems, the aches
Mhm.
and pains, the swollen joints or bad spines that some dogs run into as they age. And that's much more a large dog problem than a small dog. But again, for dogs under 25 pounds and for cats, the single biggest way to help your pet minimize their chronological aging is by keeping up with their dental care. And here's the problem. Just as for you and me, Anka, almost 85% of dental disease is underneath the gums
Mhm.
where it cannot be seen. And you and I can do the world's best job of looking at our pets' teeth and at our pets' gums, and as can your veterinarian. But the honest truth is that unless your veterinarian takes X-rays of those pets' teeth, you're never going to know about that dental abscess. You're never going to know about that cracked tooth root that is making your pet painful on a daily basis. And so the unfortunate truth for many people when it comes to pet dental care is this. Non-anesthetic dentals, where you just take your pet in and have somebody scrape at their teeth, that does nothing but scare the hell out of your pet. And really, what you need to do, I mean, I'm not a huge advocate for anesthesia, but anesthesia in this case is necessary to allow your veterinarian to take x-rays of every tooth in your pet's body. And if your veterinarian can't do that, then you need to find a different veterinarian.
What makes you
So
say
that
that?
that now
Is that, I mean, like,
now
what makes you say that? Like, is that something that happens that a veterinarian doesn't want to do it
Well,
or
yeah,
doesn't
I
have
mean,
the
some
equipment of
veterinarians,
doing, or like what makes, like there's going to be something behind it for you to
okay.
explicitly mention that.
Well, yeah, and so I would tell you that now, so I'm gonna back up again and tell you that when I went through veterinary school back in the 1980s, before you were even born, Anka,
Not true.
that
I'm much older than that.
I had no dental training whatsoever. I went to UC Davis, which is, people say it was the best veterinary school in the country or whatever, and I had zero dental training at that point. But in the 1990s and 2000s, we came to understand that dental disease in pets is actually much more common than it is in humans. And one of the studies that I point folks to all the time is that in humans, if I have severe periodontal disease, my lifespan can be shortened by up to 15%. In humans, that's a decade or more. And the same thing applies to our dogs and our cats. And so I would tell you that in the United States, there are many states within the United States, Anka, where if you don't have a dental X-ray machine, by law, you cannot do dentals in the United States because you are missing so many problems. Now, the hard part is that there's a generation of veterinarians that did not have that dental training. And I took a lot of classes to make up for my ignorance along the way. I mean, and it's an economic pain because the dental x-ray machine that is most commonly used costs $30,000 to $40,000.
Yeah.
$30,000 to $40,000. And so it's an investment by veterinarians in both knowledge and equipment. And some veterinarians are not willing to make that investment. But if they aren't willing to make that investment, they are missing problems for your pet in your pet's mouth that could not only create daily pain, and who wants a toothache, but also could shorten their life.
Yeah. Is it like the same? Because in humans, I know for sure, I had it in my house, that dental problems caused all kinds of other symptoms, like
Absolutely.
weird stuff,
Yes,
right?
ma'am. Yes,
Where
ma'am.
there was like countless doctor visits from, from cardiologists to internal
Yeah,
medicine to here to there, and weird symptoms, weight loss, fever, like
you're exactly
obvious,
correct.
disease, and
Hmm.
nobody put the dots together until he got his
Right.
teeth fixed, and now it's a whole different, like, and all that other stuff went away. Is that the same
You
for
are
pets?
absolutely, you are 100% correct again. And that we know that if your dog has a heart murmur, that it is going to be worsened significantly by the bacteria from their
Mm.
mouth. We know that cats and dogs are both much more prone to cognitive disease, kind of their version of Alzheimer's, if they're
Yeah.
dealing with chronic bacterial infections within their mouth. We know that pets are much more commonly affected by inflammatory bowel disease or their version of Crohn's disease, where you see vomiting or diarrhea if their GI tract is exposed to chronic bacterial overload. And so you're
Mm.
100% correct. Not only are you helping to eliminate toothaches, which by themselves are enough of a
It,
motivation, but you're
true,
helping to
true.
extend your pet's life by avoiding some of these other health issues.
Mm. So, well, let's assume that I find somebody where I can do the x-rays. How often would you
Mhm.
recommend doing those?
Well, for most dogs and most cats, once a year is just fine.
Hmm.
But it's interesting in that I just attended an internal medicine conference, and they said that in pets as young as 4 years of age, and again, these are small dogs. Small dogs and cats are really the poster children for this, Anka. If you
Hmm.
have Leo was a retriever breed, or a dog of over
Yeah, he
40
was
or
like a
45 pounds.
corgi, kind of something like that. Yeah,
Okay.
sort of,
Okay.
yeah, 30 pounds, something
Yeah,
like
and
that.
so
Mm.
so if you have a 40 or a 50 or a 60-pound dog, your biggest concern with dental care is just to make sure that your pet has not cracked a tooth by
Mm.
chewing on something hard, chewing on a bone or a piece of wood or something like that. But for small dogs and cats, I recommend annual dental care. And sometimes if you have a little Yorkie or a Maltese or a pug, These are breeds that are very commonly affected by severe dental disease, and sometimes you even have to do it twice a year. But by
Mm.
doing so, you're going to you're going to increase your pet's lifespan, and you're going to eliminate a lot of pain on their
And
part.
a lot of suffering, right? So it's,
Oh
yeah,
man, yeah.
yeah.
If
Because
you've
the
ever
thing
had
is,
a tooth,
they don't tell you, right? It's also they
yeah,
suffer in silence, right? They're not gonna, until they really can't hide it anymore. They're always like
right.
artists at hiding everything.
Yeah, and people always say, "Well, my pet is still eating," but just like you and I do, I have a tooth. I'm probably waiting on a root canal, to be honest, over here. And all I do is I shift my food to the other side. It's
Mm,
not like I stop eating, and neither does your pet. And so the reality is that many of these dental disease issues are asymptomatic. You and I cannot tell what's going
yeah.
on in there, and the only way you can is with those darn dental X-rays.
Mm. Well, that makes a lot of sense. Yeah. So now I have two really big girls now. So
Okay.
let's talk about the arthritis and things like that. Because like one of mine is
Okay.
older, so total
Hmm.
target audience here. So, how would I know when, because that's the thing, they're not kind of going, hey mom, my bones hurt,
Yeah.
so they're not saying
Right.
anything. So what are signs people overlook, and when we talk about prevention, what is there that can be done to avoid it in the first place?
Okay. Well, once again, this seems to be a common refrain for me, but I'm going to take a step back. And, we've talked about a relationship with the right veterinarian. We've talked about consults. We've talked about diet and dentals and the like. But you know what? The number one proven way to extend lifespan in any species is way less. If you
Um,
simply weigh less, you will live longer. And
mm,
everybody in my line of work, Anke, refers to the study done by the American pet food company Purina. And what they did is they took a bunch of litters of Labrador Retriever puppies, and they fed half of those puppies from each litter as much as they wanted. They could eat as much as they wanted all the way through their life. And the other puppies from that same litter, they fed at about two-thirds a normal level. So that on the one hand, you had puppies that were eating just as much as they wanted for all their life. On the other hand, you had puppies that were not being fed, that were being kept deliberately thin by food restriction. And every other a part of their life was exactly the same. And do you know that the thin puppies lived almost 2 years longer,
wow.
2 years longer than their genetic brothers and sisters? And
Wow.
so, when you ask me one of the ways that we can control arthritic pain in our pets, I'm going to circle back around right off the bat to say, listen, the thinner your pet is, the longer and less painful they will live. And so
Makes
now
sense.
stand down off my soapbox because that's so important to me. But the reality is that when you ask what symptoms do you see? Well, I would tell you that very commonly you see dogs that hesitate instead of jumping up onto the sofa or onto the
Mm,
bed. Or if you ask them to go up a set of stairs or down a set of stairs or into a car, they used to jump into the car. They used to just go running up the stairs, and now they hesitate. They
mm,
stop, or they don't want to do that. And that's one clear sign that your pet is developing either joint problems or spinal problems. And that typically occurs long before they start to limp, Anka, long
yeah.
before they start to limp. And so when I think about the ways to alleviate joint pain in pets, the first thing I'm going to tell you is that every ounce of weight that we can take off your pet
Mm.
will make them more comfortable. I'm going to tell you there's this old saying, at least in the US and probably in Spain as well, when you're in a hole, Anka, stop digging. And so, if you can help your pet avoid stairs, sometimes the best way to alleviate your pet's pain is if you go up and down the stairs 20 times and your dog or your cat always wants to come with you, invest 20 euros in a child's gate, that you can pull across the top of the stairs or the bottom of the stairs so that they stay on one level. And
Mm.
that alone can many times make a huge difference in your pet's orthopedic health. Another thing is, as silly as it sounds, buy dogs a ramp or a set of stairs to get onto the bed or into your car. Whatever you and I can do, Anka, to eliminate
Yeah.
concussion, the concussion of jumping down from things, or the stress of having to jump up on things, will help your pet to live longer. Now, when it comes to supplements, I've got bad news for many people, and that is that the glucosamine and chondroitin, the products like Cosequin or Dasequin here in the United States, glucosamine and chondroitin has been proven not to work for either humans or pets. And I can show you 5 or 6 studies that have come out in the last couple of years that prove glucosamine and chondroitin, which is sold everywhere for humans and everywhere for dogs and cats, just simply doesn't work any better than a placebo.
Oh.
Now, there are things that do help your pet's joints and will help your joints, Anka, or my joints. Something as simple as fish oil has been
Mm.
proven to benefit our joint health. Something as simple as CBD, the marijuana derivative, has been proven to help joint health. But we think that the very best supplement is, and it has a big long name, but it's called undenatured type 2 collagen. But you and I can abbreviate it as UC-2, UC-2. And that's a patented form of collagen that has been proven
Mm.
to alleviate discomfort in both humans and pets as much as drug therapy.
Wow.
And
Wow. And
so,
is it about
yeah, and
absorption or is it about what's in it? Or like,
it's about what's in it. It's
mm.
about what's in it because what this particular supplement does, Anka, what UC2 does, is it desensitizes the immune system to the damage that is going on within our joints, and it has made a remarkable difference. I took, excuse me, glucosamine and chondroitin for several years because I played a lot of basketball at one point in my life, and so I have the aches and pains to go with that, and I just never found any improvement whatsoever. And about 3 years ago, I began taking this UC2, and it's I mean, honestly, I'm pain free at this point in time.
Wow.
I really
Hmm.
am. And it's a cheap product, Anka. You can find it. Listen, I will sell it to you, but honestly, you can find it at virtually any good drugstore, any good pharmacy in Spain or in the United States. You can buy it online. But the important part of things is listen, you need to have the knowledge. I mean, work with somebody like me or a veterinarian that you trust to really learn these things because the knowledge is out there, Anka. You and I can
Yeah.
work together to help the Leos of the world or the big girls of the world that you currently have live a longer and better life. And then the last component to it, of course, is prescription drugs. So we talked about body weight, keeping your pet thin. We've talked about lifestyles, trying to avoid the stairs and avoid the jumps, put pillows down where, or throw rugs, and that's one thing I had omitted. I bet that when you get home from shopping or whatever, your dogs come running to greet you. And as they come running to greet you, if they're running on a tile floor or a hardwood floor, every once in a while they slip and they fall.
Mm.
That is cumulative injury that is shortening your pet's life. And so, buy a cheap little rug, Anka. Put a yoga mat down where they turn the corner and head to the door. Whatever you can do to give your pets better traction will increase their lifespan. And then, so in addition to the weight, in addition to lifestyle, we talked about supplements, and then finally prescription drugs. And the combination of those 4 things will do a great job in helping older pets stay comfortable and live longer.
I love that. I mean, there's so much hope in this because there's so many things, it feels like, oh my God, there's so much we can do, right? So we don't
Absolutely.
have to just watch the decline from with a tear in our eyes,
Right.
watching them go.
Right.
So I love that there's so much we can do. So where
Yeah.
can people, connect with you, find out more, get the collagen, like, and,
Okay.
and
All
work
right.
with
Well,
you?
I'm going to give people 2 websites. My primary website is www.helpingpetslivelonger.com. Helpingpetslivelonger.com. And that's what we do 7 days a week. We answer questions, we do consults to help pets, even at a distance. And, I deal with EU pet parents all the time because we're all in this together, Anka. And there they can find drugs, they can find consults, they can find the supplements that you and I have spoken about. But here's one thing I'm going to offer your listeners in particular. And I've set up a particular website,
Oh,
www.freevetcall.com. Let me repeat that, freevetcall.com.
I love the
And if your
domain names.
yeah, and if your listeners want to check out www.freevetcall.com, that links directly to my calendar, and I'll be happy to do a 10-minute consultation with any of your listeners for free.
That is wonderful. Thank you so much. That's incredible. So yeah, I can't. That is yeah, such a generous. Thank you so much. That's such a
You
generous
bet.
offering because it makes all the difference.
It
Being
does.
able
I
to
mean,
apply it to your own pet and your own scenario, right? So
absolutely.
that's
Absolutely. We're
fantastic.
all in this together. And if I can help any of your pet parents, any of your listeners help their dog or help their cat live longer, I'd love to do it.
Well, then, thank you so much. And this was an absolute delight. So insightful, so much hopeful, so much hope and so much information. So really, really grateful. Thank you. And I'll
Okay.
hope to have you on again as a guest in the future.
All right. Okay. Thank you very much, Anke. You're doing a great job. I mean,
Thank you.
pets deserve a voice, and you are doing a great job of offering pet parents and their pets their best lives. And what rewarding work. I mean, I congratulate you
Thank
on
you.
everything that you do.
Right back at you. Thank you.
Okay. All right. Bye now.
Thanks so much for listening. If you enjoyed the episode, don't forget to subscribe and leave a review so other dog lovers can find the show. Head over to soultouchedbydogs.com and sign up for the weekly treat. Tips, recommendations, and personal stories to warm your dog-loving heart. And if you know a awesome human you think I should interview, I'd love an introduction. Email me at Anke, that's ANKE, at soultouchedbydogs.com.